two, one. Good day, everyone. Welcome to National Public Health Week. So glad to be hosting panels every day this week, 6 p.m. Eastern. So definitely check it out. Today we'll be talking about civic engagement, and I'll get to the guest in a little bit, but just to give a little overview of civic engagement. And if you have not as yet, definitely follow me on Instagram because I'll be putting out content there as well. But civic engagement or civic participation is any individual or group activity addressing issues of public concern. Civic engagement focuses on making change in a community. This includes both political and non-political actions. Civic engagement is meant to improve communities. Civic engagement is inherently public health. States where people are more civically engaged and vote at higher rates have better health outcomes, have better public health outcomes. 34% of the US residents do not vote. That's 112 million Americans that did not vote in last election. We need you to vote and be active in your community. There's a lot that can be done to ensure that the growing Black, Hispanic, and Asian populations civically engage. What can be done? So today I'm here with some brothers that I really respect, and I'm looking forward to getting their insights on civic engagement. But before we get into civic engagement and the conversation around that, I just want to check in to see how everyone is showing up today.
I'm doing great. Thanks, Omari. Thank you for setting up this space for us to talk during National Public Health Week. First of all, really honored to be here and support the Public Health Millennial, yourself in this conversation. I'm feeling all right. I had a pretty long week. Just welcomed my first son to the world, so it's very exciting. But overall, I'm doing all right. Just I might be a little restless, but I'm here. How's everybody else?
I'm doing good. Hey everybody. Showing up tired, just got off the road, traveling from Nashville to St. Louis for work, but excited to be kicking off the week with my brothers in public health, of course, the amazing Public Health Millennial. And so yeah, just ready for a great conversation.
Yeah, I'm glad to be on here with you all. It's good to be here, and thanks for putting this together. Um, really wanted to engage with Public Health Millennial and Brothers in Public Health, so I'm glad that we're having this opportunity. Um, I'm showing up as myself. Just had it's been a long it was a long month, and we we've been working a lot, and so just I'm really glad to have a moment to kind of have a conversation surrounding our community and how we can, work together to improve it. And so I'm looking forward to it.
And I'm looking forward to that too as well. I see that we are streaming on the wrong link right now. I do know that there are a couple people that are currently viewing right now, but I don't know how to do this. As you all know, I'm not a professional YouTube user or whatnot, but we'll figure that out on the back end. I hope that the people that were waiting are able to come to the event, and it will be shared afterwards. But we will make sure that doesn't happen going forward. But thank you all for introducing yourselves. I'm very, very thoroughly excited to be here today and to talk more about civic engagement. And I think it would be helpful to give the audience just a little bit brief introduction on your background and why civic engagement is important to yourself.
Shmal, you go ahead.
Sure, I'll jump in. Yeah, so I'm a public health professional. I've been in the field for a few years. Really started around the COVID pandemic, right after I graduated. Um, right now I'm in health policy, in the House of Representatives as a policy advisor. Previously, I did a lot of work supporting community health centers, and kind of fell in love with like the primary care like level of healthcare delivery and intervention, and just really wanted to like dedicate myself to supporting that and seeing that how relevant it was to my community. So that's kind of what drives me. And yeah, I'm a father, I'm a husband. Um, I'm here in the DMV, um, and just trying to build community that is looking to do the same things. So I'll pass to Miles.
Appreciate it. Yeah, I'm also located in the DMV area. Um, so I work as an epidemiologist for the Office of the Chief Medical Examiner, and community engagement is important to me in respect to my work because as an epidemiologist and identifying trends related to mortality that occurs in the district, and having a public health background, my goal is to prevent deaths, basically, prevent disease, ultimately death in our community. And the only way to do that is to make sure that our community is informed of, and again, in relation to my work, make sure that the community is informed on certain risks that are involved with certain types of deaths that occur, so that we can prevent those deaths from occurring in the future. We just got over the hump of COVID-19, so we did obviously have a spike in deaths in the district, but the number of deaths have continued to rise throughout the years. And a lot of things are preventable. So again, to me, just the reason civic engagement is important to me in relation to my day-to-day is to save lives.
Yeah. Hey everyone, Winston Wellington Wright. Currently serve as program manager of diversity, equity, and inclusion at BJC Healthcare, which is one of the largest healthcare systems in the United States. We serve Kansas, Missouri, and Illinois. Before my role as program manager, I was an administrative fellow. So I spent 2 years under hospital and health system leadership, really understanding hospital operations and strategic planning or strategy from kind of that executive senior leadership lens. And I graduated with my NPH actually in 2019. So started my public health career right before the pandemic. And found myself in a space where I was serving one of the largest hospital systems and helping executives really just plan and execute operations all throughout the pandemic. And one of the things that really shocked me regarding just the knowledge of health policy within the health administration world was the lack thereof of knowledge of health policy by a lot of the senior leaders. There's definitely more knowledge on the regulatory side in terms of like all of the rules that come from the federal government that impact hospital operations. But in terms of, some of the larger sweeping things, I was just really shocked at how many senior leaders were not aware of things. And I always say, like, I'm an Obama kid. We're kind of all Obama kids in terms of, George Bush was the first president I remember, but Obama was like my president. And I think one of the most impactful pieces of legislation that's ever been enacted into law was the Patient Protection Affordable Care Act, aka the ACA, aka Obamacare. And so that really influenced me in the first place to really get into healthcare. And when I was in grad school at Morehouse School of Medicine, I did a lot of research on health outcomes in Medicaid expansion states versus non-Medicaid expansion states that expanded Medicaid under the Affordable Care Act. And I ended up working in Missouri, which is a non-expansion state, and ended up living in Tennessee, which is also a non-expansion state. And the health outcomes, of those state legislation decisions to not expand Medicaid using those funds was obvious. Missouri has one of the worst rates of infant mortality and maternal mortality for Black babies and Black moms in the entire country. And one of the most stringent Medicaid programs in terms of qualifications, only second to Texas in the entire country. So when I think about civic engagement, beyond voting, which, personally is something I really didn't step into until I can admit this, 2022, I was one of those young, rebellious, F the system kind of cats for a minute. But beyond voting, it's really just about knowledge about policy and legislation, right? We live in a very polarized climate ever since 2016. And I just think it's important for people to know about their representatives, know about the kind of legislation that can impact their life. Of course, today we're going to be talking about their health. And so those are all reasons why civic engagement is important to me.
I really like the tie there because everything in there goes from local all the way to national policies. Everyone's talking about how it affects us, our communities, our families, and then we think about the communities that we serve and the communities that we're working alongside and how the policies really inform the systems and the ways that we live. And I think in just thinking about that, what strategies can be employed to overcome some of the barriers to civic participation, particularly around marginalized communities, and to promote meaningful engagement in local and national governance?
So I can go ahead and jump in, although I feel like this is going to be a hella basic answer. But I think, leveraging social media has really been key. 2016, I think, we saw Facebook be like a major vehicle for information or misinformation. Beyond just the presidential election, but in local and state elections as well. And I think, we already are at a good point, or at least all the social media pages I follow, in terms of young people of color, that are really putting out amazing content to inform people. And I think that if we think about just the reach of TikTok and Instagram, I think I actually Googled some statistics regarding Instagram, but it is one of the major news sources, actually, for American adults. I think 16% of American adults get their news from Instagram, which made up a bigger share of users' news media diets versus TikTok or X or Twitter. So, I think just continuing to be intentional about what we're putting out there, how we're trying to inform people, and being precise about the information that we're presenting them is one thing. So leveraging social media is big, and I have some other thoughts, down the road about that. And then the next thing that I would say, which has been dope for me to see, just more candidates, but I'll be candid, more progressive candidates emerge, is really a key strategy is like actually developing like people to become the representatives that we want to see or the policymakers that we want to see. Now that I have a chance to work in healthcare and work on the corporate side, I definitely think like, okay, I need to be able to have allies in the policy space that are going to push legislation through that really are going to impact the things that I want to impact. And so I think we need to be intentional about how we're developing our youth and how we're, preaching about civic engagement. So, we can inspire more people to be the representatives that we need in the future.
I like to add to that if I can. So some of the notes that I jotted down to this question, and again, it might sound a little cliche, but I was saying we can, tell our community to reach out to our local elected officials, and push for them to stand up for whatever issue it is that we feel needs to be addressed. Or ask them questions, where do they stand on this? Do they know about this? Stuff like that. I actually, it was interesting. I had what was he, a state representative who was in my state in Maryland. They offer scholarships under our delegates. So I reached out to one of my delegates to kind of get some information on the scholarship. Went to his website, phone number on his website, called it. He picked up. I was so shocked and surprised that he picked up his own line, not like a secretary, but that's like the type of immediate access that we need. But yeah, I would, if any delegate state representative is listening, I would definitely suggest doing that, because creating a seamless line of communication allows your community to feel more involved and appreciate you even more. But to my point, call your state representatives and give them a piece of your mind. They're there to represent you. Again, of course, we might have some elected officials who are corrupt. But again, to Winston's point, that's where we as a community need to work towards building individuals who can take their place and do the work that needs to be done. There was also something else. Oh, when there are some issues that have been large enough that have been organized for committee meetings, and there's like private sessions and open sessions. We need to have more public people present in those open sessions, and really challenge those officials in charge, because a lot of the time you might have people who are just they're elected board members only because they have tenure in their organization, but they don't necessarily care for the issue at hand. But if you challenge them, they're responsible for making sure that your questions are answered. To be honest, and I'm sorry if I'm going a little bit too long on this, but I've noticed, unfortunately, that there's sometimes in some public committee meetings, it's difficult to find out when and where they're being hosted, and that can kind of be a disparity in and of itself. But if you can get to those rooms, if you can find out when these types of meetings are being held, that can drive a lot of action.
I agree with a lot of what's already been said. I think there's different levels of how we can overcome some of these barriers to civic participation, and also there's ways we can be more strategic. At the most basic level, I'm thinking about the Black community first and foremost always. Knowing our neighbors and being organized with them and knowing what we all are asking for collectively is kind of our first step to building political power and being organized. In my experiences, I found, oftentimes we all might be experiencing symptoms of a similar problem, but if we're all voicing it in slightly different ways, we might not be adequately addressing it, because we're not being strategic in our demands or in our asks to our elected officials. So something that I want to see more of, is like more organizing, but also something that Winston pointed out was like on the political educations piece, social media has been so powerful, and we've seen that like over the years, right? I think some of the best thing about social media right now is that the stuff that goes viral, the stuff that gets a lot of views, is always like relevant to a specific audience in a very specific way. And so maintaining relevance is like one of our strategies to keep people engaged. If my main issue is that there's not enough groceries at the grocery store, you can't come talking to me about, some other public health issue. I want to focus on getting food from the store to my house. So we have to be relevant to the communities that we're trying to engage with. And so we could probably talk for hours on this one question alone, but I think there's a lot of different ways we can start to build power, that we've done in the past already, but trying to do again in the future. And I think when we look down the line, we can have enough influence as a community to start to sway some of these candidates that we're seeing pop up, both on the progressive sides and not so progressive sides, and start to see real changes in our community.
So hey, y'all, lifting up a lot of leveraging social media, ensuring that like we're maintaining relevance in social media around political topics, around topics that matter to community, as well as the importance of developing our own people that we believe should be representing us at whatever policy level, and then also the need for accountability and open sessions and having the community be able to access those meetings. And I think this is so important, just that we continue to organize it. And I think Winston said it earlier, but it's so important. It is so many times we think of civic engagement as just voting, or we think about our civic engagement as in it's election time. Let's think about this now, and then after that, it's done, and we forget about it. But it's so important that we are continually having the conversations, continually raising the issues with our representatives, and just as a community is like sharing like these are the things that are important to us, and we need representatives and people out there that are going to work with us to create these solutions to these problems. And I think that that's very important. And I just wanted to talk to Shamal, and before I get to the question, I see that people are on this live, so be sure to hit that like button, share this with a friend who will get some value from this conversation. And I think it's very important that we are having this conversation, but it's always better when more people are able to hear and listen and take the insights and perspectives so that we can continue this conversation outside of this panel. But Shamal, you work as a policy advisor. When people are reaching out to you in your work or the person that you are working alongside, what's the best advice that you would give those people to have like an impactful conversation with you?
Great question. Something I think that is the most effective meetings are sometimes often the shortest, because they're very clear and concise. Here's the problem that we're experiencing. Here's what we're asking you to do. And sometimes people come and say, here's some help in, starting the process on addressing this issue. That I was just talking to a friend about this the other day, who's also a policy advisor. The Black community needs more of that. And I think I was hinting to that, some of that, in my previous answer, but being concise when you're reaching out to a legislator's office, and also sometimes you have to be consistent, and you can't just show up once, is how you can start to work towards your desired result. I'll start there.
I love that. I love that. And I think it goes back to something I think ideally we would like. When Miles said it, it's like we would love to always be able to pick up the phone and talk directly to our representative, but we also have to understand that there are people that are in a lot of meetings and they wear a lot of different hats and again pulled in a lot of directions. So to that point, when we are given that 5 or 10 minutes, do we have the problem and the solution given in a concise way with data, with stories to really like sell what we are trying to get and support in our community? I think is important. I wanted to go back to Winston because I think this is an important conversation as well. You're talking about that you were someone who's like, oh, let's F the system, let's break down the system. Like, I don't think it's important for us to vote, or like you didn't see that as something that was hugely impactful in your life. What changed?
I think number one, transitioning into a different tax bracket, so going from a graduate student to all of a sudden being a working professional. And I think, with my fellowship, I had a lot of experience behind like the actual just political spaces in healthcare as well, in terms of like, again, I'm in Missouri, so we have an extremely conservative government. And I'll give y'all an example. I've been in like meetings and behind closed doors where state representatives may come in and say, yo, why do y'all have a transition clinic at your hospital? Like people are starting to raise alarm that this is going against our state's values, and are you messing up kids and all of these different things. So I got to see like just how ideology and political agenda really starts to impact individuals' lives on a day-to-day basis. So that was the first thing. And then again, I'm pretty unfiltered. I think, 2016 was an interesting time for me. It was the first election or first presidential election I was going to be able to vote in. And this guy, Bernie Sanders, emerged, and I was like, oh wow, like he really speaks to all of the policy ideas that I have as a young person. And I definitely did not foresee Donald Trump being elected during that election. Like I just thought it was a joke, and I was like, oh, it's not gonna happen. So after 4 years of living with that reality and then moving again to a state, because I went from Atlanta to Missouri, Atlanta to St. Louis, moving to a state, it was a culture shock in terms of how his presidency really empowered high level executives across the St. Louis region to essentially embody all of these, I wouldn't even call them conservative, really alt-right ideas. And I was just like, holy smokes, like this is very real. Like there are people here who genuinely believe like Black people thriving is a threat to their existence. Like, hold up now, like I feel like I'm in the Jim Crow era living in St. Louis. And so just being exposed through my professional career really made me think like, okay, I can't be a part of the demographic that doesn't care and that doesn't use my voice. I'm an educated Black man, proud HBCU graduate, privileged enough to be in the position that I'm in to impact the care and the provision of care of big Black community here in St. Louis and the other states that we serve. So I got to do something. So that was the first thing, just being shocked by the reality. I think the second thing, and I actually wanted to say this, is really knowing the history. On top of the pandemic, obviously that was a year of civil unrest, as we call it, or social unrest, regarding just Black death and police brutality in the United States. So I just went on a crazy binge of just reading all of these books and learning more about particularly the Jim Crow era, the civil rights movement, all the things that we don't learn in school, and the things that I didn't even learn at Morehouse or Fisk University, two HBCUs. And I realized just how censored our history and our education has been. And I also realized, to Shamal's point, like we've been did this. Like we have had to organize like on a mass, nationwide, national level to bring about change for our people. And so when I really started to understand just what, people who have come before us have done, that's when I started to, kind of shake off that mentality of like, it's we got to tear down the system. It's like this is a system. Capitalism isn't going anywhere. We got a long way to go, in terms of, I guess, creating the country that we want to create or continue to create. But it's called a more perfect union for a reason. And it's not going to, get more perfect, quote unquote, unless we continue to do the work. And so, voting, I realize both in my local elections and being informed on what's going on in the cities I live in and work in. But of course, also national elections, it's just, one piece of the puzzle. And it's an easy thing that I can do. So that was really those things that triggered the change in me.
Well, I appreciate you sharing that. And I think that's an important narrative to share, and understanding that like making no choice is a choice. And like we sometimes give up our power before we even able to utilize it, and knowing that our voices, our choices, how we decide and live our lives are important, and voting, civic engagement is part of that. And I think, like, to your point also of, we see that leadership could stray a certain way, and if we aren't there, there is no accountability, there's no counterbalance for those types of issues. So before I move on, thank you, Ale, for the comment in the chat. If anybody would like to ask a question, feel free to drop that in the chat and I will ask it afterwards. So I definitely try to get some people that were not Black on this panel, but it just happens to be that we are all Black men in here. And I think it's important because one of the things that I've started, and with my two of the three co-founders here, with Winston and Miles' brothers in public health, and one of the things that we're trying to do is to get more Black men into public health, into change agent spaces for their communities, to really realize full self full health realization and self-realization in that as well. So I want to start off with Miles, and all of you are welcome to jump in afterwards, but organizing for public health in the Black community, why is that important?
It's important. I mean, before this discussion, Shamal, I mean, he said himself how he was in grad school and working through his academics and didn't feel like he had like a community that he can like be a part of to help him through his journey. And I think we all share that same feeling. I was introduced to public health quite later in school. I think I was almost done with my bachelor's. Majority of my my life, really, I was like thinking I was going to be a physical therapist. But even in those like health science classes, even the intense mathematics and stuff like that, those core classes, I didn't see a lot of people that looked like me. And then when it got into the medicine courses, health related courses, it got worse. So it's important because I don't think anyone truly feels strong without somebody who is there supporting them, whether it be family, whether it be friends, or just someone in the room that looks like them that they can look up to and say, you know what, I can do this. Even if they never had a conversation with that person, just seeing someone there makes a huge difference. So as it relates to brothers in public health, I mean, I had always yearned for a space where I can be that role model, or other guys can be that role model for each other and lean on each other for help and support when they need it. But also because we know in our communities that without it, our health outcomes are going to suffer, and they will continue to suffer. So yeah, that's my answer.
I'll jump in and organizing for public health in Black communities. So I'll again use COVID-19 and the pandemic as the prime example, right? I remember supporting the incident command center at our flagship hospital here in St. Louis. So a bunch of physicians, a bunch of executives, we were working like 14, 15-hour days. And nobody was talking about any of the data stratified by race, right? And this was at a point in time when the term data transparency started to kind of emerge in the public health world, because it become realized that a lot of healthcare organizations were not reporting. When I say healthcare organizations that are providing services, we're not reporting, outcomes based on race or zip code, gender, any of that. And so here in St. Louis, the first people that were actually accounted for in terms of deaths due to COVID-19 were both Black women, one in St. Louis City and one in St. Louis County. And they were both healthcare workers, and nobody was talking about this. And after the news broke that it was two Black women, everyone just assumed that, oh, well, it's because the Black community aren't, adhering to the guidelines, they don't care about the social distancing, you drive in the hood and everybody's still out. But the reality was that was not true at all. Black people in St. Louis were not moving any differently than any other people in St. Louis. And what I started to notice is, even from my own healthcare system, not to incriminate myself or get myself in trouble at work, but even with my own healthcare system, where we were launching testing sites at the time, none of them were in Black neighborhoods, like absolutely none of them. All of them were in West St. Louis County, which is hosts some of the wealthiest neighborhoods in the United States. And I was just like, yo, like, you want to know why our rates are higher, beyond, the chronic diseases and the comorbidities that we know the coronavirus at the time impacted more so. Like people don't even have the ability to test because healthcare systems are neglecting these folks, right? And it's a similar pattern with a lot of different healthcare issues that our people go through. And Amara, you and I have talked about this before in different spaces. If we think about the Black Panther parties of the world and the free food, programs, or the health clinics that they set up, during the late 60s, early 70s in Chicago or Oakland, we have always had great examples of why it's important to organize for public health in the Black community. And I think Shamal said something that was really powerful actually to me, which I'm going to remember. Know your neighbor, talk to your neighbor. How many times do we talk about, particularly as Black men or men of color, using the barbershop as a venue to, host and have these kinds of health conversations and spread health awareness? And I think that as long as we are continuing, I'm sorry, I'm trying to wrap this up. I don't want to go too long. But as long as we continue to live in a state where our health outcomes are directly impacted by the legacy of Jim Crow, we are always going to be on the short end of the stick when it comes to political decisions that impact healthcare and that impact health, right? So that's why it's critical. I mean, I think at the dinner table, I think at the basketball court, when you're linking up with your guys to go to the game or watch the game, whatever it is, like health has to be like a top three thing that we talk about, right? Like we just have to talk about health as a people, as a culture. And I think, and I know the question was specific to Black men, but even, shout out to Alex who's watching in the chat. But even when I think about our Hispanic, Latino community, the same thing. And even when we think about the American indigenous population, I remember there was a lot of news about how reservations were being significantly impacted by the pandemic, and there was hardly any service, during the first few waves. And so I think for people of color, and I'm gonna get into a little bit of a not angry radical bag here, but when I see, the focus of jogging and hiking and being out in nature and accessing green space and, white folks shopping at Whole Foods and Trader Joe's and looking at all these different things, I know that our community does that as well, but it's still not normalized, I feel, in a large part. I'm from Philly. And when I have my friends like visit me in Nashville, when they visit my wife and I, they're like, why do y'all go walking? Like, what is this? And I'm like, come on, y'all. Like, we gotta be in nature. We gotta get active. Like, you can't just sit and go to work every day. Like, you gotta get some oxygen. And so I think, just because the literal state of our community, because we as Black people, but specifically as Black men, will continue to be on the totem pole. And of course, we all, are working to change that every day. That is why there's always going to be a critical need for organizing for public health in the Black community.
Yeah, I think y'all both hit it on the head. Like, um, this is important. Not not just for like emergency responses and stuff, but for so many of the things that we're um, seeing year over year in the Black community. Um, our maternal mortality rates are way above where they should be. Um, gun violence is still impacting the community in a very serious way. We need to find like public health oriented solutions for that. You know, there's when we talk about a lot of our health outcomes, a lot of them are symptoms of poverty and inequality. So we need to build public health approaches to poverty. And so um, organizing for public health is what's going to kind of change the narrative of our community and change the narrative of our country as a whole. And it's particularly important for the Black community to be leading in that space because we experience some of the worst health outcomes for almost any condition that you can put out there. So, we have to continue to do this. I love that you pointed out the Black Panther Party um, being the inception of what we now know today as community health centers. That came out of a Black radical F the system space. And it's okay to have a little bit of that F the system, as long as you know how to work it and build power in your own community to make that change. They didn't say I'm going to go to elected leaders or, I'm going to go to the ballot box. They said we're going to take what we have in our community and we're going to, change health outcomes. And so there's also some of that, we talked about not just voting, in November and then, letting it drop off there. Those are some of the like peak outcomes that we can get, when we effectively organize. And we have to maintain, those sort of programs that, can feed children, that can service the sick. So, we need to continuously, like Miles said, build pipelines for young Black men, young Black people to get in the public health space. We need to advertise it more. I also didn't, get into the space until kind of like later on into college. Like, okay, this is what health policy is. This is what it means to, impact population level health as opposed to, the individual. So we need to like build that pipeline and, help, young brothers and sisters stay engaged throughout their academic journey so that they make it through and, they can be in those decision making spaces where, there's people advocating to put all the COVID testing sites in one neighborhood and they say, hold on. You completely forgetting about my people. And, so that way we can prevent that from happening the next time there's a pandemic. So it's going to be a multi-pronged process, but the importance is there, the relevance is there.
Be sure to put any questions that you have in chat before we wrap up soon. But thank you all for engaging. And hit that like button. Continue to share it. Greatly appreciate you all sharing the conversation. And it will be here on YouTube to live afterwards. But I really appreciate you all highlighting. We first need to start with our neighbors. We need to start with supporting our family and friends, creating that internal community, building out bigger communities where we support people, ensuring that the narratives around health inequities are there, and ensuring that we are using data and stratifying it by race so that we can know the stories that are there and the inequities, and we can drive towards change so that it actually impacts those inequities and the communities that are most impacted by the issues. And Shamal, you are not lying. A lot of the things we talk about just generally in public health, symptoms of poverty and inequality, and it's like, how do we solve those things in a broad way? And I think to the point is like public health is a pathway to help us support that. But many of us don't know about public health until later on, and knowing that we can impact our communities in a positive way, which I think is so important. But I appreciate you all engaging in that conversation right there, because that is important. And yes, Ali is agreeing with us that she also discovered public health in the very last bit of her bachelor's degree. So I think it just goes to show that while we are doing this, having this conversation here, there's so much more that needs to be done to ensure that public health is a pathway that people know that they can do this work in. And I feel like we all have to do our part in being the storyteller and sharing that narrative more broadly. And I guess on this trend here, and this is, I guess, going deeper into this, we think about the men of color that graduate from Masters of Public Health programs. We think about Black men being, I think, 3.17%. All other men of color are in very similar relative percentages graduating, while those same men and population of men are the ones that oftentimes suffer from the most health inequities, health disparities, systemic barriers. I don't know. Talk to me more about that.
Oh, so it's not lost on me that, like, while we're all educated, and I know, as public health people, we may think of education as a protective factor, higher income as a protective factor for certain health outcomes, but we know it's not, right? Because we know even when you control for rate, for education and income, for particular with Black women, maternal mortality, the rates are still there. And just personally, I have homies who are victim of gun violence. I have homies who are uh, caught up in the mass incarceration system, despite being master's level graduates. My father died what I would consider a premature death from congestive heart failure. Um, and so, while I work every single day for one of the largest hospitals, it's not lost to me that I could also be a patient in the bed in one of those hospitals. Um, just because the fact that I'm a black man, realistically, and try to live the healthiest life possible. So, when I look at statistics, when I'm on projects at work or initiatives where it really does touch, a significant part of the black population that we serve, it's a struggle for real, if I'm being honest with y'all, because a lot of times it's hard for me to remove myself in order to be the best that I can be to serve others. And at the same time, it's the reality that I use to kind of refuel myself every single day. Because when we even think about like just our initiative with Brothers in Public Health, right? Even as brothers that are highly educated on this call, and I didn't even consider myself that until I really looked at statistics, like, oh wait, no, like we are a small percentage of black men in the United States. When you talk about people that actually, pursue education past the undergraduate level, I think it's important for us to just be grounded in that reality. And one thing that I always try to encourage folks is to continue to push the status quo and center your reality and your experience. Because I think whether you're working as an epidemiologist or you're working in the political realm or in healthcare, a lot of times just the pressures of conforming and assimilating, even in those spaces, sometimes can make us drop the ball, right? And obviously we all have a job to do in our respective roles, but just remember the reality, like I'm working for myself, my brother, my best friend, my dad, my granddad, my uncles, my cousins. I'm working for all of those people at the end of the day. And so that's just the immediate reaction, Amari, to what you said that I have.
But like Winston says it best. I mean, I don't really know what more to add to that, but Winston and I, we've talked previously about how um, just creating creating the space for men of color to understand that this is a career pathway that is worth pursuing is a big challenge, but something that we really want to push forward in our initiatives for Brothers in Public Health. Um, some of the barriers to that, other than just education, is can I pay my bills off that? We all know and we've heard from many people in the field that public health doesn't pay a lot. Arguably, I think if you play your cards right, you can do well for yourself. But I can understand that as a concern. But either way, you know, we do see the trends and just anyone who does pursue higher education individually, they do have better healthcare outcomes. Um, but I think at the end of the day, we need to, again, like we want to say, root ourselves and remember, like we're doing this not for ourselves, but for our community. At the end of the day, at the end of the day, um, and the only way to, well, not the only way, but in my opinion, the only way to help our community have better healthcare outcomes is to be the change, be the ones that they can look up to, be the ones that they can respect and trust, and hopefully bring more people along with us.
Well said. I think you know, um, we definitely need to build representation in the field. I think something that's important that I thought of while Miles was speaking was the need to communicate our value. um, to the public and to, elected officials. Um, and part of what that means is like, public health got really popular during the pandemic, right? They were like, what's happening and who's going to respond to it? And that's when, the epidemiologists and you know, the the physicians and experts started to weigh in. But understanding that public health is not something new and that there's a lot of value, there's a lot of existing research, there's a lot of existing programs that have proven successful that, you know, um, people would view as either taboo or, you know, something that is like unattainable in our political landscape. Um, but understanding that if we can build the will and understand the value that's already existing in the field, then we can already make a lot of change. Um, One of the examples I think of when I say that is like the concept of, injection sites for, substance use disorder treatments and overdose prevention. Um, there's a lot of people that think of that as a wild idea, but the results are there, and uh, if we can start to build political will to change our thinking of how we're going to address some of these societal issues, um, we can make the change needed. So we need to start, like I said, communicating our value, building representation so that people from all walks of life um, can contribute to decision making and resource allocation in public health. And then we need to, work to pressure our government to invest more in public health. It's like you said, Miles. It's not the most glamorous or high paying sector. A lot of us, I think all of us on this call are in here because of how we've seen it impact our families and ourselves. Um, but you know, there's no reason that there shouldn't be greater investment in the field because if anything, the pandemic showed was that we need a more robust system. So um, that's what we're going to start to do.
If I
This has
can,
been,
sorry,
yeah,
Mark.
please. No,
If I
go
can,
ahead.
I'll be real quick, but I think one thing I just really wanted to add was like, we talk about public health, talk about we want more people to get into the field. Um, but public health doesn't necessarily mean you have to go get your master's in public health. Like public health is literally everywhere. As long as you have or you understand the principles of public health, you can start to understand different industries where public health plays a part. So like you can be a construction worker or work in construction and be involved in public health. So that's just kind of what I want to add. Just be aware of be aware of your surroundings, um, and understand how one thing impacts another. That's all I got to say.
No, that's very important. I'm glad you raised that up. And if you want to know the diverse ways that public health intersects with different topics, different sectors, be sure to tune in to the rest of the week for National Public Health Week panels, 6 p.m. Eastern, all throughout this week. Check out thephmillennial.com/NPHW for more information there. And there should be a link below as well. So before I close us out, it would be great to end on maybe like one or two sentence call to action around civic engagement. And I know this wasn't in the question, so you might have to think about it. So I'll talk a little bit now. So be sure to hit that like button if you have not as yet to share this. Let us know what you enjoyed in the conversation. Be sure to follow these lovely men on LinkedIn and let's continue this conversation. Let's continue to build the networks and throwing it back to you all.
I'm gonna steal what Shamal said. Yeah, sorry, because I love it so much. Just know your neighbor, and know what concerns y'all have in your community, and talk about it. I think it starts with the individual first, and then branching out, right, next door, your homie, whoever. Like, you gotta start having the conversations about just health in general, and looking, at all the different ways that your health is impacted. So I think, what is it relates to civic engagement, I think, that's just something, Shamal, thank you for sharing that. That's really gonna stick with me. Just really knowing your neighbor and truly understanding, what are the issues that, are impacting all of y'all, and what's that collective call to action y'all want to make, or we want to make, excuse me, to our elected officials and others.
I'm gonna sum it up in 2 words. Those 2 words are get involved. It doesn't have to be glamorous, doesn't have to be a big old rally or a protest to get your message across, but get involved with community, understand the problems that your community is facing, and just figure out a way and a solution. Well, even if you don't find a solution, just understand what's going on. And then going back to what I mentioned earlier, reach out to your locally elected officials. If you're not really into being political, there are people who are there for you, who are responsible for representing your entire community on behalf of you all. So yeah, my message is to get involved, and just share the message.
I'm never going last on one of these questions again. But in a similar vein, though, I'd say my call to action is to find your people. There are existing organizations, if you're into political organizing, or just community organizing to drive change in your community. There are people out there that are also looking to do the same, and there's existing organizations. Reach out. Social media is a great tool for that. That's how I got my first kind of involvement in political organizing in Virginia. Looking out to see who's doing abolition work, and I found people. And so find your people. Stay educated, stay informed, and you'll start to make some change.
And you'll be sure to subscribe to Public Health Career so you can hear the entire Shamal's story in the near future. But thank you all for the enriching conversation today around civic engagement, around getting involved, around just wanting and doing the things that our community needs to ensure that we are working towards positive changes towards health and just that self-realization for our entire communities. So I appreciate you all. Thank you all for joining us today on this live. Be sure to like if you have not as yet, subscribe, share it with a friend, check it out on Public Health Careers. Appreciate you all. We will see. Well, I guess I will see you all tomorrow if you'll hop on the live. Peace. Okay, it has ended.